Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel. And today we have part 2 with nurses Karen DiMarco and Antra Boyd. They started the company Renegade, and they also have a podcast where they speak about patient advocacy and they're impacting the way nurses receive education. In the rest of this interview, in part 2, we get into their perspective of the medical sales industry, what role they believe a medical sales rep plays and how it's important to their role as nurses, what they're really doing with Renegade, and how they came to create everything they have created for nurse education and impacting patient outcomes. It's definitely an episode you want to listen to. And as always, thank you for listening to the Medical Sales Podcast, and I hope you enjoy the rest of this interview.
Medical device pharmaceutical rep to get to know the nurses. It doesn't matter what area a nurse works in. If they can get in and develop relationships, there's influence there.
Big influence. So let's talk about that for a second, because you made a really good point. You said, it's really up to the example you used was pharmaceutical. It's really up to that rep to figure out how to get that nurse's time. Think back to when you guys were busy and you guys were making things happen, and a rep tries to stop you to get your time. What do you want to hear from that rep that would even allow you to consider, okay, let me stop and give them a couple of minutes? What kind of approach would you be most receptive to? And this is completely subjective, but I'm curious to know.
I know what I would say.
Go.
I mean, when you show up as yourself, and you're doing your thing, people know it. You don't even have to say, right? Like presence, I want to be here. I'm interested in good outcomes, like just showing up and being yourself. But, sales can be pushy, and it can be, when somebody's on the
in the weeds,
when they're trying to push a drug and they're really trying and they're just like, white knuckling it. It's like, do I have to as a nurse? But the ones that I love are the ones that are just like, they just show up. They're themselves. They're personable. They're real.
Got it.
And I know it.
Authenticity is what you're looking for.
Yeah. And you know what? There is no Academy Awards for nurses. I mean, and we need such little encouragement. Mm-hmm. It goes so long. We're so thirsty for support and encouragement.
That's a great point.
You want to get in good with a nurse, take 15 seconds and watch them. And then tell them and acknowledge them. I see you.
An amazing
I
job.
see you.
Oh, I love that.
I wish I came in here because I wanted to talk to you. I see you're too busy. So I just want to acknowledge.
Yeah. That's a really good point.
I mean, and they'll give you the 60 seconds they don't have.
They will.
But it has to come right. It can't be blowing smoke, because they'll smell it like a mouse fart a mile away.
Yeah.
You can't be inauthentic. They've got very refined detectors. But if you truly take some of your own time to give it to someone else, to just watch another human being in the weeds, and go, man, I wouldn't want to be you. I actually came here to try to sell you something. I'm not going to sell you anything.
That's excellent.
That sells.
Yeah.
That's good. That's
exactly.
Good. So, this is that actually segues us to the next question I want to ask. I don't think people truly understand the influence nurses have when it comes to the provider's choices. Can you guys speak a little bit about what that looks like? You spoke to it earlier. You said medical reps don't do enough. They don't realize how important it is to really establish a relationship with the nurses. Tell us why. Tell us what kind of influence you guys really have in the whole process.
I think the influence we have is better patient outcomes, right? Let me think about this for a minute. When a physician decides to, use a robotic machine, let's just use that again as an example, since we've been on that track. That's really not part of my decision-making process, really not part of, the OR manager. Yes, the hospital administrators to, figure out the financial aspects and that side of it. But I think, we're after quality patient outcomes. And if research demonstrates that this is a device that's going to, improve outcome, then I think that's what we're after. And so our influence is on, we want the best outcomes for our patients. So if you work with us collaboratively, if we're a team, if you teach us what you know, I think that's a huge piece of it. And I think that nurses should have more influence in terms of that whole, from start to finish in terms of what we're purchasing. We had an OR redesign at my hospital, and there were no nurses at the table. And they built the boom where all the technology sits right in front of the bed. So you couldn't get a gurney in there.
Wow.
I would have been like, no, that is not going there, because that will be that's bad for patient outcomes. Right. If you need to get a patient to an ICU because they're doing poorly and you got to maneuver around this technology boom, right? And so I think we should have more influence. And I think in the nursing world right now, we're starting to see nurses are the change. We are going to be the change for healthcare because we're the boots on the ground, and so are you guys, right? And so I think, to me, it's all about really good patient outcomes, and I think nurses should have more influence than they do when it comes to that higher level. What devices are being used, what drugs are we using, because we're boots on the ground.
To me, if a medical or pharmaceutical rep wants to have influence or even sell and get in front of nurses to educate, go for the ones that are outside of the system like us. There are huge Greater National Advocates. GNA, for instance, is a whole conglomerate of patient advocates. If you guys want to educate patient advocates so that they can help their clients make fully informed decisions, that's a great way to have that influence. Because then the advocate, when they're helping their client make fully informed decision, is going to say, this hospital has this kind. And this is what I learned about this kind. This office, this rep, they prescribe this drug. And this is what I want you to know about this drug. You make the decision, but now it's fully informed. So what else? We've got Trisha Torrey's group. There's Greater National Advocates. You can, if you just Google, I'm just giving you
there's all sorts of ways to educate.
Make a phone call and say, I'd like to tell you. So when you're with a client who has this issue, you know what to look for. You know what hospital to go to, you know what doctor to go to.
Yep. That's a great point.
Yeah. Too. Find the nurses who have already spit themselves out of the system, because within the system, they're going to help, but they're not going to have the influence they do.
Not right now, but yeah. I think it's coming.
That's what we're trying to change. But
got it. Well, let's talk about that for a second. So you said that's what we're trying to change. So we understand what you do as far as being patient advocates, but how are you going to change the influence the nurses in the system have from where you guys are?
Well, we're through the work we're doing now and the Renegade company and the podcast, we're shining a light on people we're more the megaphone for the people who are creating those changes. And the education we provide is also different and is going to, we're patient advocates. So we're telling nurses and communities how to advocate for themselves. And that's going to be that grassroots, ground up, percolation of change. But also, we had a couple of nurses on our podcast that were actually creating the anti-magnet hospital kind of thing. Like hospitals, we're a magnet hospital. Well, to nurses, that doesn't mean much.
Let's get some context, because a lot of people listening might not understand what that is.
Okay.
So what exactly? So well, first of all, you guys have a podcast that educates nurses, and it sounds like you're saying that as you guys continue to disseminate information through that podcast, it's going to increase the belief that a nurse has in the system to do differently and impact a bigger change. So tell us some of these definitions. What is a magnet hospital? and what is the issue you've seen with, I guess, magnet hospitals?
As far as I understand, and it's not a fully informed understanding, magnet hospitals have to have a certain amount of their staff, their nurses have to be degreed. We could go on about what that means, if it means anything. They have to have a certain level, a certain percentage, I think, of credentialed specialty, like with the CCRN, in critical care, and the what's the trauma, the CT, I had both of them. I can't remember.
CNOR for the surgery.
Yeah, exactly. They have to have those specialty things. And then once they achieve that, or if they're on their way to achieving it, they pay like a couple $10,000, $45,000, $50,000. Again, this is me. This isn't researched. This is what I remember hearing from someone else. And they get to stamp their hospital magnet hospital. Well, it's polish. It doesn't really have a whole lot of substance, because I've worked, at least from my personal experience, I've worked at magnet hospitals. I've worked at small community hospitals, and you're only as good as your lowest common denominator. You could have that stamp, but it's just lipstick on a pig to me. Now, what nurses are doing, because it's a really a hierarchical thing. It's like we're a magnet hospital. It's really just window dressing. But there's nurses going, no, we're going to make a real kind of credential so they're creating this groundswell of these apps where nurses can report their satisfaction of working there, how much they feel supported by the administration, because the safest hospitals are the ones where the nurses feel they love to work. I mean, why else would they like to? Because they feel safe working there. They feel that they're supported, either staff ratios or team spirit, or they're getting educated, they're getting improved. So these nurses that we've interviewed are making apps where nurses can report that kind of thing. So say it's the grapefruit app. Okay, I just saw that on my soda can. So say that they're creating all this data in grapefruit of where the nurses want to go and work and what the conditions are they're working. Hospitals, instead of wanting to be a magnet hospital, they want to be a grapefruit hospital, because that's going to help them attract and retain their staff, which is going to increase their employee satisfaction, which is going to increase their patient safety and patient satisfaction. It's going to be a ground up instead of a lipstick on a pig thing.
And if you're a patient, you can go to that app and you can see where, nurses' greatest satisfaction is in terms of where they work. And you'll be like, yeah, I don't want to go to hospital B because those nurses are unhappy. I'd rather go to hospital A because they get their staffing ratios are good. They're not burnt, whatever those metrics are. So, and this is just to, reinforce what Karen is saying. This is because nurses are creating this. This isn't being created by, some high in the sky organization or administrators or the healthcare system. This is being boots on the ground nurses who are doing this. And this is why this matters.
Okay. That's excellent. That's a beautiful thing to hear. Okay. So one thing I want to address, COVID, the big elephant in the room, it's seeming to come down a little bit, right? We just been allowed to walk freely and not wear our masks all day long. Everything's being addressed. How it was difficult for medical sales professionals to get access to healthcare administrators, to nurses, to doctors because of COVID. And over that time, a lot of medical organizations kind of said, you know what, it's kind of nice not to have reps coming in and seeing us. Maybe we should kind of keep it this way. How would you guys, if you guys have seen this from your side, please speak to it. And what could you say, now that things are being let up again, how should medical sales professionals approach their accounts?
Why would they say it's kind of nice?
So as you guys know, when you guys were in the field, you guys would get a lot of reps coming to see you, right? And sometimes that can be really, it can just be an interruption to an account and how they're operating and what they're doing. Now, maybe not so much in medical device. Medical device, it was more just safety. But in pharma, that can be an interruption to have another sales rep that has a competing product try to get more of the providers or the account's time. So when COVID happened and there was no access, some providers preferred it, and they said, when we come out of this thing, we might want to kind of keep it this way. But there's still value that, of course, sales professionals can bring. And from a nurse's perspective, what should a medical sales professional keep in mind to make sure that value is understood?
I think we already touched on it with the authenticity and the, honestly, like, I can't think of anything else better than that, because people know, right? Like, they just know. And if you're coming from, I got to make my numbers and I got to sell, yeah, there's not going to be time for that. There just isn't. But the relationship is important. And like I said, I have some really good friends who are medical sales reps, because they're real and they're authentic, and they're, they have all of these qualities that are, attractive to be around and fun to be around. Like, to me, that's the most important thing. And and then I'm like, yeah, I'd have my hip done with a Mako machine. Like, it's because of that.
Yeah, it's like sales 101. I'm preaching to the choir. I mean, that's why I asked the question, why didn't they want them around? It's because they felt that they were selling them something. But people want to be seen. So if that's what you're doing, they'll want you around. I mean, my first and best lesson in sales was my family has a produce company, a wholesale produce distribution. My brother has innovated, and like all the fresh cut fruit and vegetables you see in the grocery stores, he was doing that in 1994. He has created some of the machines that have automated that stuff. This is in Northern Ohio, right in Cleveland. Right. He sent me to Pennsylvania, Erie, Pennsylvania, when he first started selling these fresh fruit cut trays, sent his little sister out to the grocery stores in Pennsylvania so that the customers would know that this was coming to the grocery, so that they would ask the grocery stores, So I'd go and stand in grocery stores with this tray of fresh cut fruit and go, one fruit. I'm selling, I'm bothering them. And I finally was like, screw this. I'm just suck at this. I don't know what's going on. So I would sit there, and I like people. I really have a genuine curiosity about people. So I'd forgot the fruit. Like, oh my gosh, I love your hat. Where'd you get that hat? And they're in the produce section. Then you see people, see them genuinely. Yeah, take 5 seconds to see them. And then they're coming over and they're talking to me. What are you selling? I'm like, oh, my brother just started this thing. He's really trying hard. She's like, oh, I'll take one. Right. So ask yourself the question, why don't they want you there? And do something about that. And it's because you're taking up their time that they have limited, but you're taking their time. If you're giving to their time, by seeing them, by acknowledging their hard work or whatever, and that's what you're going, and also acknowledge yourself that you're providing information. How is this office, this hospital, this unit, this whatever, going to innovate and grow and advance unless they're trying on new information, new innovations, new things? Yeah. You have value to give them,
right. And that goes for the providers too. I mean, doing that for the providers, because I don't think many providers get an Academy Award either, and they're tired and burnout. So
for sure.
If a pharmaceutical rep comes to a doctor's office and they're kind of like, it was so nice in COVID not to have all these people here. Well, just like what Karen said, be interested, notice them, pay attention. And what value do you bring? Right. Exactly. I mean, to me, that's everything.
I love it. Okay. All right, ladies. So give us the name of your company one more time.
Renegade. See what we did there?
Renegade. I like that.
It's a play on renegade, but take out first E.
And it's company specifically for patient advocacy. And no. Okay. Correct me there.
No, that's all right. It's hard to follow.
I know.
Okay.
All right. So we both I live in California. Antra lives in Oregon. We both had, private patient advocacy businesses, but we did different things. I was more on education and community stuff like that. And Antra's working with, a thriving one-to-one business. But we've been friends, as we said. We met through going through a patient advocacy program, and she's just my sister from another mister. I mean, we would have these, we just knew we'd do something together. And so my nursing license had expired. And because I was procrastinating, as 99% of nurses do, to get those 30 CEs every 2 years, because the education is antiquated and the delivery mechanisms suck. And it's just like they wait to the last minute because it's like we're learning all the time on the job anyway, right?
But tell them really quick, what's CE?
Oh, sorry. Continuing education credit. You need 30 of them.
Like exactly what CME credits for physicians.
Exactly.
Right.
Exactly. Okay, so cut to a chase. I listen to podcasts all the time. I ask myself, I get so much value out of listening to podcasts, especially if it's like medical health related, whatever. It makes me a better practitioner, a better teacher, and it also improves my life. And it's not available. YouTube videos, you can watch all the YouTube videos and listen to all the podcasts and audiobooks you want, but they're not CME, CM or CE credits. Screwed me up. So we decided like that's stupid. So we got our CE providership, created a podcast. I mean, our job is to interview amazing, interesting, fascinating people that we would want to learn from. And it's worth a CE for a nurse, but that is just where it started because we want to make education in itself. That's our renegade is a.
Well, I was just going to say that the thing is that, typically in the world of continuing education for nurses, oh my God, so boring. It's the worst ever. And it has been for 20 some years. Like, poke your eyes out. That's why nurses wait to the very last minute because it sucks. And, to Karen's point, why are we not getting CEs for stuff we're already doing? Number one, that is up-leveling us, making us better nurses, better people. And could we please just get some interesting information out there? And oh, by the way, do I really have to be chained to a computer for 5 hours to get the CE? Could I just do it while I'm mowing the lawn, taking my daughter to the airport? Could I just listen to it? Why does it have to be, the delivery method has to be so antiquated? That was a huge part of the motivation. Was Karen left her license at the very last minute for renewal. She had to go and get 30 CEs. She, found some interesting material that she had to sit in front of the computer for 12 hours to listen to.
Right.
And
24 hours.
Yeah. She's like, I'm not doing this anymore. This sucks.
Yeah.
So, okay. So Renegade, is Renegade's sole business turning content into CE credits, or is the patient advocacy and all these other things included within the umbrella of Renegade?
Well, it's not a patient advocacy company, but it's going to be an academy. So there's the podcast, that's like the 1 hour CE credit you could get. We're also creating courses, but also in a fun vein that you can listen to on the go, 20-minute quick modules, convenient but entertaining. Like we want you to snort laugh when you're listening to our stuff. But also an academy. So there's longer programs, like the program we went through, RNPA, that's our registered nurse patient advocate, where you learn about functional integrative medicine, systems biology, epigenetics, nutrigenomics, not just like keeping people safe in the medical system, like how to reverse illness, like that kind of stuff. We hope to be putting that certification program on the RNA platform too. So it's
doing education for nurses a different way. I mean, I think that, from my personal experience, and I know Karen can speak to this as well, nursing education needs an overhaul. It just does. I mean, I think that the professors and the teachers and the people that are out there educating, they do want to do a good job, right? Just like nurses and doctors do want to do a good job. But the system is it's just backwards, and it's not helpful. Nurses who graduate with their bachelor's degree go into the field and they don't know anything. It's terrible. There's a huge gap between what they learn in nursing school and actually being a nurse. Like, why is that? Why and why can we not get enough nurses through the doors? Because we won't hire brand new nurses because they know nothing, right? And so we're really interested in flipping that model and doing it differently. There's and a lot of nurses are actually interested in that. So I think we're part of a movement that is redesigning and rethinking the way we educate nurses.
Got it. So
this is kind of our little piece.
Got it. And the education is just for nurses, no other group.
No, anybody can listen to the podcast.
Right.
Okay. Oh yeah. And it's really helpful. Like just for example, we have a woman who owns a medical equipment company. She's a nurse. Okay. She's a clinical nurse. She specializes in lymphedema. She's in northeastern Ohio too. I think Toledo. She told this story. I mean, Antra worked in an OR. I worked in ICU. I knew what lymphedema was, but I never had to deal with it. So it wasn't something, I mean, I'm like listening to this. I'm like, lymphedema. Why are we doing a podcast on lymphedema? Okay. I'm game. I'll learn. Fascinating. And anyone listening to that podcast, and this woman, she told a story of, I'm like, why did you get into lymphedema? She tells a story of her father had stomach cancer. His legs were so swollen that when he was getting confused the night before he died, while he was in his lazy boy chair, he grabs the handle on the chair. The legs come down and burst open. He spent the last 12 hours of his life in excruciating, because he died the next morning, in excruciating pain. And we were both like, oh, that could happen. And we learned so much from this woman. Now we're doing a longer, and anybody listening to that, just say a lot of doctors and nurses don't have that knowledge. Obviously, we didn't. So Mama has had her arms swelled up for the last 5 years and nobody knows what to do with it. They just keep giving her Lasix. Well, that's because it's not edema, it's lymphedema. So the public, just a layperson listening to that podcast is going to go, that's what it is. And they're going to educate their doctor about what it is and how to treat it by listening to this woman. So that's, another thing it does.
That's excellent. So Our Renegade then provides training and resources to everyone with more specific training for nurses.
Exactly.
That fair? Got it. Okay. Excellent. So, ladies, how can someone find the resources that Our Renegade provides?
Karen, this is you go, because you have the elevator voice, the sexy elevator voice.
Go to rrenegade.pro, rnegade.pro. If you're a nurse, you'll be able to go on there, and it's just a subscription service. It's like Netflix or whatever. Nurses can pay. It's a nominal monthly thing, and then they can get unlimited CE Bar podcast. So at least they're, so you can get, and we have this really cool new technology. It's called, basically a nurse can listen to the podcast, with her phone, and with the app, press a button, speak into the phone to answer the activity question and do the evaluation. And then the certificate gets shot out to their email. And then we store all of their CEs too, not just the ones they get through Our Renegade. So it's also a storing and organization. We will feed, shelter, and water your CE certificates. So when you need them, we have them. And we have a Facebook group too. You don't have to have a subscription to be in the Facebook group. And we do community, like I'm doing an educational event on March 30th about the ultradian rhythm.
That you have to be a nurse to join the community.
You have to be a nurse to join the community? Yeah, well, we'll probably put that lecture on podcast. That'd be good.
Okay.
And you can find our podcast on Spotify and Apple Podcasts. So if you want to, if you're a layperson or not a nurse and you want to listen,
it's the purple snake wrapped around a microphone.
Our Renegade, look at that. Okay. So anyone listens to the podcast, of course, the Facebook group, though, to join that, you need to be a nurse. And to find the Facebook group, just type in Our Renegade in Facebook and it'll pop right up.
Yeah.
RNEGADE community.
Under the groups tab. Yep. It'll pop
Excellent.
right up.
And then lastly, does your company turn other people's content into CE credits?
Oh, that's a good question.
Coming soon.
I mean, how brilliant is that, right? Because then you're really talking collaboration and team and shining the light on other people and what they're doing. Like that, to me, is so exciting. So, yes.
And I mean, to be honest, the first podcast that gave me the idea was Joe Rogan. He had James Nestor. The guy wrote a book called Breathe. I learned, it was fascinating. 2 hours in a podcast. I'm relearning anatomy and physiology of the nasal, whatever, and the respiratory system. And he goes into the history. He has me under the catacombs in Paris, comparing skulls and, talking about tribes and different religions that used breath and all this stuff. I'm like, what the? I'm like, why is that not worth CE? So yeah, eventually we'd like to just, if anybody listening to this has, like you, Samuel, has a podcast that they would like, nurses to be able to get a CE credit for too, how to find us.
What's funny about that book too? I was just thinking while you were talking is, as a surgery nurse, I didn't understand how detrimental sinus surgery could be. And I did sinus surgery all the time. Now, are patients fully informed if they don't understand the risks of removing the filtration system of our noses?
Sure.
Right? Like, it never even occurred to me that would be something that I would want to know as a patient. Now maybe I still decide to have surgery, which is perfectly fine, but I didn't even know. So like James Nestor, who wrote this book on breathing because he was having breathing problems, totally educated me. I would, in a clinical setting, I would definitely educate my patients differently because of his book.
Wow. Powerful stuff.
Yeah.
Okay. No, that's inspiring. That'll definitely make you want to lead to creations of all the wonderful things you guys are doing out there. Okay. So with Renegade, they can find you on Facebook, renegade.pro, and anyone can listen to the podcast. Nurses can subscribe, and in the future, sooner than later, anyone with content will be able to turn that into a CE credit.
Yeah, if you want to reach out, I'm Karen at renegade.pro. So I'll say that again, RNEGADE.pro. Skip that first E. If you're listening to this and you have great content and you think maybe a nurse could get a CE credit for it, just reach out to us. Yeah, give us an email.
James Nestor, if you're listening.
Right.
Right? Hey, who knows? It might happen. It might happen. Don't be surprised if you contact him.
Wouldn't that be hilarious if he did? He was like, "Oh, I totally wanted it."
I'd make a whole other episode just about that happening. But ladies, thank you so much for joining us today. We had some fun. We got to talk a lot about what's going on and how it applies to medical sales professionals, and the influence that you have as nurses, and of course the amazing things you two are doing with Renegade. So thank you. We'll be keeping tabs and looking out for more stuff. And thanks for the time today.
Yeah, you're welcome.
Thank you, Samuel. Thanks to your audience too, and go team.
Yeah. Just a quick nod really quick to medical, sales reps in general. I don't know that we covered this, but in my experience, I've had some really amazing people come in and be part of the team, and really good at what they do and so knowledgeable. And so I encourage nurses to also reach out and to, use them for the resource that they are, because they know a lot.
Excellent.
Yeah.
Thank you, ladies.
Okay.
And that was Karen DiMarco and Antra Boyd with our Renegade. It's fantastic to see medical professionals, when they leave the industry, transition into just new, innovative resources that change lives. What they're doing for nursing education is groundbreaking, and the way they're doing different things to impact patient outcomes is fantastic. As always, we try to bring you guests that have innovation, see things differently, that are doing things to really further healthcare, whether it be education, whether it be the technology, whether it be people skills. We bring guests that are making a difference. So maybe you're listening to these episodes and you're someone that's wanted to get into the medical sales industry. Maybe you are in a customer service role, or you're in a sales role, or you're in a role that has nothing to do with medicine and absolutely nothing to do with sales. And you're thinking to yourself, how do I get into the medical sales industry? You've gotten a few interviews and you're not getting past the first or second round, or maybe you've applied to a few places and you haven't heard back yet. Well, it's time to stop wondering how you're going to get in and actually do something about it. You need to visit evolveyoursuccess.com and select Attain a Medical Sales Role. Fill out the application and schedule time with someone from our staff and have a conversation about how you can be in your next medical sales role. And if you're someone that's in the field, you're a medical sales representative, and you're thinking to yourself, you're a sales associate or you're a sales rep, and you're thinking to yourself, this year I really want to make a difference. You've gotten a new role and you want to really start with a bang and increase your numbers. Or you've been in your position for a while and you're saying, you know what, I'm ready to do something different to get where I ultimately want to be. Then again, visit evolveyoursuccess.com and select Improve Sales Performance. Fill out the application, follow the prompts, and have a conversation with someone from our staff and learn how this can be your groundbreaking year. We're always going to do our best to bring you guests that are changing the scene in healthcare, and we're always going to be providing resources that help change the scene for your careers. As always, thank you for listening to the Medical Sales Podcast, and make sure you tune in next week. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive-level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.